Hi there, I'm Dr. Ajaya Kashyap and I'll be talking today about non-surgical methods of improvement of your breast shape and your breast size. On non-surgical, I would include anything that does not involve any major cuts. So the first thing I would briefly talk about is the Brava breast enlargement method, where silicone cups are put in and little vacuum is generated, and you put them on for about 6 hours a day, and over the next several weeks you can have enhancement of the breast size. And what happens is that the tissue, because the vacuum, the tissue starts growing in, the vascular tissue and other tissues build up in the area, and what you have is enlargement of the breast to a certain extent. Sometimes it can be used for enlarging the breast with fat eventually, so that the more of the fat can be injected and the enhancement of the size can be achieved, which would not be achievable by either means alone. Now, that is something that people often find inconvenient. 6 hours a day for several days a week, for several weeks or months, may not be something that everyone wants. However, it may be used for as an adjuvant, as when you're having fat injections done anyway, you could try that for a few weeks, about 3 or 4 weeks, and then you can have a better take of the fat that is injected for breast enhancement. Sometimes I do the same thing, increase the circulation with radio frequency, with something like Thermitide. It increases the circulation, and then you can inject more fat in and have a nice enhancement of the breast. So this is for breast enlargement without actual surgery. You can say putting in fat would be the surgical part, but the Brava method is non-surgical. The second thing that some people talk about is hormone injections, and that is something you should never even think of getting done. It is harmful. Some people say that you can have some kind of mesotherapy, which does have some harmful things. Sometimes it can be of some use, but in general, mesotherapy does not help with either the health of the skin of over the breast or of the size, or nor does it cause any lift. The third method that I use frequently is called a Thermi-Bra. What it is a radio frequency assisted lifting of the breast. The lift that is achieved is moderate. You can have about a centimeter sometimes increase in the lift of the nipple areola complex. But what happens with that is that the areola, which is usually very expanded when the breasts are ptotic or droopy, the areola size decreases, and that is a big advantage. It is done without any visible cuts, just through needles and through radio frequency waves. The results start in about a month or so, and they are complete in 4 months. And they are long lasting. I've seen them last for 5 years or more. Again, the lift is moderate, it is not a lot, but what it is non-surgically you achieve a very decent result for people who require it. So the carefully selected individual can have good results. Another method that I sometimes use for people who have crepey skin and the skin itself is wrinkled and is not exactly as we wish to be after having babies and so on. Sometimes what I do is called vampire breast lift. The results again are moderate, but the quality of the skin can improve, and there can be some lift and enhancement of the breast. And all you need is your own blood, and sometimes they add some antioxidants. And then you inject them on an OPD basis, outpatient basis, without any major anesthesia, just maybe a little bit of local anesthesia or topical cream, and that's it. So you can have some enhancement, some lift of the breast with vampire breast lift, but more than the lift, what you can get is better quality of the skin. And adding some antioxidants can help with the skin quality as well. The next thing that I do for breast enhancement, breast lift, is adding a little bit of fat, and that, as I said, you don't need to increase the volume as much. Very often after having babies, there is emptying out at the top, and for that, use fat from anywhere you can find in the body. You remove it with like a thick needle. It's a cannula, small cannula. I do it with a water jet liposuction technique. Remove that, and then put it on exactly where you need it, where the breast would look lifted. If you don't want much volume, you will have kind of a lift with the enhancement exactly where the hollowness is, usually at the top. So you can have, without visible cuts, you can have a fairly good result. and most people accept it very well, and the results are long lasting. What lasts after 3 months is going to be there for years and years and years. Next is a lot of people are looking for liposuction breast reduction, and I think this is something that I do sometimes based on the individual's needs and desires. The reason for doing it is because there are no visible cuts. I put a very small cut within the areola complex, couple of them, and sometimes a very small cut on the undersurface. There are no visible cuts. And with liposuction, you can remove a fair amount of fat in ladies who are postmenopausal or ladies who have more fat than glands. So a careful analysis is required to see what the ratio of the fat versus glands are. And once you have seen that and you see that there's more fat, you can certainly remove it and get a very good result. You can reduce the breast by 1 cup size, sometimes more. And that is all that many women need. The only problem is you won't get a lift with it. And sometimes I add a thermi breast with it so that you can have kind of in the bra region, I kind of put the thermi probes in so that you can have tightness there, and then some on the top. Also beneath the nipple areola complex that shrinks the areola and also lifts the breast a little bit. So between that and some fat injections, you can have a very good result for people who want a breast reduction without having any visible scars at all. But again, carefully selected individuals who need some breast reduction, but not a whole lot. And those who do not want any cuts at all. And often those ladies are those who have more mature breasts. The younger breasts have much more glands and less fat, so they may not be the ideal candidates for a non-surgical liposuction breast reduction. The other procedure sometimes people ask for is for the breast is just removing of certain parts which are unsightly, like a little fold next to the breast, and that you can do with simple liposuction, and that works out really well. The shaping of the breast, the size of the breast, the lifting of the breast, and sometimes reduction of the breast can all be accomplished to significant but limited extent by non-surgical techniques or non-incisional techniques, which work out quite well.